Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Peritoneal lavage fluid, and we are looking at the criteria. So under this, we look at first is the positive. So under positive, it includes greater than 1 lakh. So it is greater than 1 lakh red cells, as well as red cells per microliter. Next is greater than 500 white cells. So greater than the 500 white cells. This is also in microliters, and it is equal to 175 units. It is equal to 175 units. That is amylase per dl. So under positive, there is also the bacteria on the gram-stained smear. There is bacteria, and this is on the gram-stained smear. Gram-stained smear. And then comes the bile or the food particles. So bile or the food particles. Now let's move on to the intermediate. So the criteria of evaluation in terms of the intermediate, it will include a pink. So pink is very important. There is a pink fluid on free aspiration. So on free aspiration, there is a pink fluid, and there are 50,000 to 1 lakh. So 50,000 to 1 lakh red cells. 50,000 to 1 lakh red cells per microliter, and this is in terms of the blunt trauma. So it is these many red cells per microliter of the in blood trauma. Next is the 100 to 500. There's 100 to 500 white cells. So 100 to 500 white cells, and this is again to the microliters. And there is 75 to 175. The units of the amylase per dl. So in positive, it was bile and food particles and bacteria on the gram-stained smear, and the values based on the numbers. Now let's move on to the negative. So in terms of negative, there is presence of the clear aspirate. So negative means there's clear aspirate, and next there is less than 100 white cells. So there is less than 100 white cells. So white cells, as we are seeing, in positive, white cells was greater than 500, and in intermediate it was 100 to 500, and in negative it is going to be less than 100. And then is the less than 75 units. So it is less than 75 units of amylase per dl. To learn and grow daily like this, please do subscribe.